upper limb. Okay, so if you see, this is the upper limb. Okay, here are two upper limb, one is on the right side and one is on the right side. So first of all, just discuss the bone. This is the scapula. You can see it from all angle. This is from the anterior side, this is from the posterior side, this is from the lateral side, and this is from the medial side, this is from the superior side, and this is from the inferior side. So this is the scapula. Another bone here is the clavicle. Okay, this is the humerus, and below here there is the radius. Radius is toward the thumb side, and there is the ulna. Ulna is toward the little finger. Okay, now these are the three bone. Now another bone, there is a carpal bone. Okay, so carpal bone, how can you remember the carpal bone? She looks too pretty. She looks too pretty. She looks too pretty. Try to catch her. You have to just remember this sentence, and after this, she looked too pretty. Try to catch her. These are the eight boon. And how can you remember that? She looked too pretty. Try to catch her. She means scapoid. Look lunate. T tracheatum pisiform. She looked too pretty. Scapoid, lunate, triquetrum, pisiform. Okay, another bone is the trapezium, trapezoid, capitate, hamate. So here you can see that this is the hamate, and we will explain each bone one by one. Okay, now another thing you have to just, this is the carpal bone. After carpal bone there is a metacarpal bone. Okay, this is the first metacarpal, which is the thumb. Okay, this is the first metacarpal, and this is the second metacarpal, third metacarpal, fourth, fifth. These are the five metacarpal. After this there is 14 phalanges. In the thumb there are two phalanges. First, this is the proximal and this is the distal. Okay, in the index finger there is, in the all other finger there are three phalanges. Okay, so this is the proximal phalanges, this is the middle, and this is the distal. Proximal, middle, distal phalanges. Okay, so this is the second finger, this is the third finger, this is the fourth finger, this is the fifth finger. In third finger there is the proximal, middle, distal, proximal, middle, distal. Okay, proximal, middle, distal. So these are all the bone of the upper limb. Now we will explain each one by one bone. Okay, so this is the scapula. So from the scapula you can see here, on the anterior side of the scapula you can see this is the subscapular fossa. Okay, on this is the subscapular fossa on the anterior side. On the posterior view, if you see the posterior view, what you can see from the posterior view, first of all you have posterior surface of the scapula, and here is the infraspinal. This is actually the spine. Okay, this is the spine. Okay, on the posterior spine, this is the spine, subscapular spine. So below there, this is the infraspinous fossa, and above is there is the supraspinous fossa. Another thing in the spine you can see, this is the lower lip of the spine, this is the upper lip of the spine. Okay, and another thing you have, this is the posterior side. On the posterior side you are seeing this thing, and you can see this is the acromion. Okay, and this is actually the acromial process. I will explain which processes are present in the scapula. Just see posterior view. Oh, you can see this is the acromion, this is the acromial angle. Now here you can see this is the borders. Okay, three borders, three angle. I will explain. This is the inferior angle, this is the superior angle, and here is the superior angle, inferior angle, this is the mid, here the middle angle is present. Now the border, you can see this is the middle border, this is the lateral border. Actually this is the lateral border. Okay, and this is the superior border. Now just go to the medial side. On the medial side you can see this is the medial side. Okay, you see only the border. On the superior side you can see from this there is the articular surface of the clavicle. Here the clavicle is attached. This is the acromion, and this is the acromial angle. Okay, this is the subscapular spine, this is the upper lip, and this is the supraspinous fossa. Here is the superior border, here is the superior angle, here is the medial vertebral border, here is the subscapular notch. This is the notch that is called subscapular notch. Okay, and this is the coronoid process. Here is the supraglenoid tubercle. Here is the supraglenoid tubercle. It is different type of muscle attached to here. We will explain it. Now on the medial side, this is the medial side. This is the superior side. This is the inferior side. Okay. And on the lateral side, this is the lateral side. Okay, on the lateral side, you can see here, this is the glenoid cavity. Okay. Now we have explained the scapula. We will explain the other bone. Okay. Now which is the second bone is here, the clavicle. So in the first of all, we will isolate the clavicle. You can see the clavicle. This is the clavicle, and you have to just the this is the anterior side, this is the posterior side, and this is the lateral side. Okay, this is the medial side, this is the superior side, and this is the inferior side. So on the anterior side, you can see this is the sternal end. Okay, this is the acromial end, and here is the acromial facet. We will explain each by superior side. On the superior side, you can see here is the conoid tubercle. Okay, here you see the conoid tubercle. On the lateral side, you can see here this acromial facet. This is the acromial facet. Okay, we in which the acromion is attached. On the medial side, you can see this is the sternal facet. So one is the sternal and one is the sternal and another is the one is the acromial and another is the sternal side. So you have to see from the superior you can see the acromial end. Okay, and also posterior you can see conoid tubercle. On the inferior, when you see the inferior you see here is the trapezoid line. Okay, here is the subclavian groove, here is the costal tuberosity. So this is the sternal side. In the sternal side, for example, when you come from the sternal side, you just see here the subclavian groove in which the subclavian artery, subclavian vein, etc. below there is all things are supplied here. Okay, there is the trapezoid line. So we have explained the clavicle. Now come back to here. Another bone is the humerus. If you see on the humerus, what you will see, now just see here, this is the humerus, and you can see how is this located. Now this is the humerus, and you can see from the anterior view, you can see there is the lesser tubercle and this is the greater tubercle. So on the posterior side there is a greater tubercle, on the anterior side is a lesser tubercle, and here is the head of humerus. Between the head of the humerus and lesser tubercle there is a anatomical neck. This is the anatomical neck. Okay, and this here is the surgical neck. Here is the surgical neck. So this is the anatomical neck and this is the surgical neck. Okay, now the greater tubercle and lesser tubercle, between them there is a intertubercular sulcus. So this is the intertubercular sulcus where are the ligament move in this. Okay, we will explain that the muscle in the muscle video. Okay, now so this is the anterior side. So this is the crest of lesser tubercle. Okay, here is the crest of greater tubercle. Now you can see here, when you come on the anterior side, you can see this is the deltoid tuberosity which the deltoid muscle is attached. Okay, now another thing you can see, this is anterolateral surface and this is the anteromedial surface. Okay, now come on the distal end, you can see here there is the one is the capitulum and another is the trochlea. These are two things you have to remember, capitulum and trochlea. Behind the capitulum, trochlea, you can see the coronoid fossa, and capitulum you can see the radial fossa, because here the radial bone is attached. Radial bone come here. Here is the coronoid fossa because the ulnar coronoid is the process in the ulna bone. So coronoid fossa, coronoid process is coming here. Okay, now on you can see there in the medial side you have medial epicondyle and the lateral side you have the lateral epicondyle, and there are two lateral supracondylar region. Okay, this is the lateral supracondylar region, this is the medial supracondylar region, and here is the lateral supracondylar region. Now on the posterior side you can see here there is the olecranon fossa. What? Olecranon fossa. Okay, because here is the olecranon process is attached. Now this is the lateral side, radial groove. Here on the posterior side you can see there is the radial groove. Okay, in which the radial nerve and radial artery etc is coming here. Okay, radial nerve. Now this is the here the radial nerve is going on. Okay, we will explain that. So this is the superior side. From the in the inferior side you can see like this. Okay, this is the medial side, this is the lateral side, this is the posterior, and this is the anterior. Okay, so we have explained the humerus. Now come back to the radius. Okay, now on the radius you can see here, this is the head of the this is the head of the radius. Okay, so in the head of the radius you can see this is the articular fovea. Here is the neck of the radius, here is the radial tuberosity. Okay, this is the neck, head of the radius, this is the radial tuberosity. Now you can see there is a line anterior border, and this is the introitious border, this is the anterior border, this is the introitious border, and this is the posterior border. So we have two border, one the anterior, one is the posterior, and one is the introitious. Now come here and you can see there is the lateral surface and there is the posterior surface. Now you can see here there is the ulnar notch, and below the ulnar notch there is the carpal articular, and there is the scaphoid surface. So these are the carpal articular surface, but here is the scaphoid bone is attached, and here is the lunate bone, scaphoid and lunate. So the attachment of the scaphoid fossa and scaphoid bone is actually attached, scaphoid and lunate is actually attached to radius bone. So you have to remember this thing. Okay, if your radius bone is broke, etc., this fossa will be gone. Okay, and scaphoid and lunate bone will be in danger. Now on the posterior side here you see there is the dorsal less lesser tubercle. Okay, on the this side you have styloid process, on the medial side you have the on the medial side introitious side you have the ulnar notch. Okay, this is the ulnar notch because the ulnar bone is attached to here. Okay, now here is the styloid process of the radius, here is the dorsal lesser tubercle. Okay, now here you can see the carpal bone, and carpal bone is attached to here, and here is scaphoid bone is attached, there is the lunate. So now can see here from the anterior side, this is the anterior side, you have explained everything. This is the posterior side, this is the lateral side, this is the medial side, superior side, and inferior side. Okay, now come back to the another bone, that is the ulnar. Okay, so in the ulnar you can see here in the ulnar, this is the thing that is attached to it. So this is a trochlear notch because trochlea is present attached to here. This is the coronoid process, coronoid process, and during the during the extension in extension relaxation, these coronoid process are attached to coronoid fossa. Okay, here is the radial notch. Okay, radial notch of the ulna, radial notch of the ulna, this is the ulna bone, and this is the radial notch because radial bone is attached here. This is the supinator crest because supinator muscle is attached to here, and this is the olecranon because here this is the olecranon process, and behind the humerus there is the olecranon fossa, and that is attached to there, and this is the ulnar tuberosity. In the radius there is radial tuberosity, and here is the ulnar tuberosity. This is the anterior surface and anterior border, this is the introitious border, here you can see this is the posterior border. Okay, and now here this is actually the head of the ulna. So you have to remember that head of the ulna is to the distal side and head of the radius is to the proximal side. Okay, so there is the articular circumference, and here you can see the styloid process, this is the styloid process of the ulna. So now just see from each view, this is the anterior view, this is the posterior view, the lateral, medial, superior, inferior. Okay, now come back to the carpal bone. In the carpal bone you see the trapezoid bone. Okay, so we will just hide the other bone. Okay, now you just see here is the so this is the This is the scaphoid bone. Okay, this is the lunate, and here is the triquetrum, and this is the pisiform. Here you can see trapezium. Trapezium have a tubercle of the trapezium. On the posterior side, you can see here is the trapezometacarpal joint. Okay, TMC. This is the TMC joint, and this is the intermetacarpal, because this is the metacarpal bone, and between these metacarpal there is the intermetacarpal joint. So first of all, we explain the bone: scaphoid, lunate, triquetrum, and about that is the pisiform. Okay, so another on the another line there is the trapezium, trapezoid, capitate, hamate. So you how can you remember that? She looked too pretty. Try to catch her. Okay, catch her. Now another thing we have, this is the intermetacarpal joint, this is the carpometacarpal joint, and this is the intercarpal joint. Okay, now come here and just see this bone. Fifth metacarpal, this is the metacarpal, and the metacarpal, you see, these are at the base of the metacarpal. This is the shaft, this is actually the shaft of the metacarpal. Okay, and this is the head of the metacarpal. Now on the middle, you can see here is the base of the middle, and this is the shaft, and this is the head. So each metacarpal is like this. And now you can see this is the tuberosity of the distal pharynx. So here is the tuberosity of the distal pharynx. So anterior side, you can see this is the anterior view, this is the posterior view, this is the medial view, this is the left superior view, this is the inferior view. Okay, now we have explained all the bone of upper limb. Okay, thanks for watching.